All right. Hello, everybody, and thank you for attending today's 2024 Pre-Rulemaking Public Webinar. My name is Jacob Webb, and I work for Battelle, and I am the task lead for the Measures Management System Pre-Rulemaking task. We are fortunate to have many presenters on for today's webinar. Throughout today's presentation and during the Q&A portion at the end of the meeting, we'll hear from various subject matter experts from organizations such as the Centers for Medicare and Medicaid Services, Battelle, HSAG, and Mathematica. Next slide, please. Before we begin, I just want to go over a few housekeeping items before we dive into our discussion. First, all audio lines are muted for today's presentation. If you have any questions throughout the presentation, please feel free to submit them using the Q&A function that you should see at the bottom of your screen. Presentation slides will be available on the Pre-Rulemaking Resources page on the MMS Hub following today's presentation. A recording of today's presentation, as well as a Q&A summary, will also be published on the MMS Hub in 3 weeks, and we will share that page with you in the chat in just a moment. Speaking of the chat, today's presentation, we will be using the chat to share important links and resources with you, so please be on the lookout for that. We will also add all resources shared in today's presentation in the Q&A summary post-event. After today's discussion, we will conclude with the live Q&A of in-scope questions. Please note that if we do not get to your question live and it is in scope of today's presentation, we will answer it via the Q&A summary document following the event. Next slide. And as I mentioned on the last slide, we will be using the Q&A function. To ask a question, please click on the Q&A button, type in your questions, and press submit. And with that, I would like to move to the next slide and introduce Mel Gross of CMS to kick us off with the agenda.
Thanks, Jake. Hi, everyone. My name is Melissa Gross, and I am the task lead for CMS's pre-rulemaking processes. And so today our agenda will include talking about the entire pre-rulemaking process and timeline. We will go over our Merit tool, or the Measures Under Consideration Entry Review Information tool, and describe some of the changes and features within that tool. We will cover a brief review of the new primer processes under the new CBE Battelle. We'll also share some pre-rulemaking resources, and we will do a tour of our pre-rulemaking webpage in the hopes that sharing these resources will make this process easier for all of you during this measure submission cycle. And we'll have some time for some Q&A at the end. Next slide. All right, so to talk about the overall, pre-rulemaking process and the timeline, next slide, we'll cover why we do this in the first place. So HHS has been tasked with being statutorily required to have a pre-rulemaking process for the selection of quality and efficiency measures under the Social Security Act. And there are phases within this process. One, there's the beginning phase, which we're in right now, where candidate measures are submitted through CMS Merit. Once we get past that and Merit closes, we have a part of the process where the measures are reviewed, and we develop a list of measures that we must publish no later than December 1st. After that, we have multi-interested party groups providing recommendations to HHS, and that report is to be published no later than February 1st. After that, if a measure is selected to be in a program, then it will be, eventually published in the proposed and final rules in the Federal Register. Now that is a quick kind of simplified version of the process, but we have a timeline further down in the slides that we'll explain in much more detail. Next slide. So I'm not going to go through and read every single program on this list, but these are the programs within CMS that participate in the pre-rulemaking process. So you can just take a moment just to scan through. Okay, next slide. All right, and now we'll talk about the timeline. Next slide. Okay, so we have a couple graphics here for you today to kind of outline the activities. And like I said before in the previous slide, I gave a condensed version of what the pre-rulemaking process and the timeline looks like, but there's a lot that goes on. And so in order to make that process more transparent to the submitter and make it easier to have kind of a visual and an understanding of like what's going on in the background, we came up with some timelines. The first one we're going to share is linear because we felt it was a bit easier visually to see this. But the full cycle for pre-rulemaking is cyclical. So as we're wrapping up one cycle of measure submissions, there's another one starting, but we'll get to that. So from left to right, if you look at that first orange dot on the left, this is kind of signifying that the measure submission period is open. And that period goes until May 10th this year. So you'll see the next orange dot, candidate measure submission period closes. So we're closing on May 10th this year. And during that time, while submitters are, entering in their information into Merit, we're also trying to do education like we're doing today. We're doing outreach for submitters. We're doing outreach for CMS program leads and measure leads, for evaluating measures in Merit. And so you see there's that bracket of time where we're kind of focusing, and which we are in right now, trying to educate everyone about the process and trying to help everyone familiarize. And so if you move past that, once Merit closes, that's when CMS programs start to review their candidate measures. And there's a long process that goes on for the review of the measures. The programs review it, we have stakeholders review it. And if you follow the timeline from June, July into August, August is where we kind of develop a list of measures that go on the MUC list, and then it goes on to further review in CMS and HHS. And that's the draft MUC list. By December 1st, we should have that document, like I said earlier, published and publicly available. After that, we have the Battelle CBE convene multi-interested party group reviews. And that is, those recommendations will be published. And that's what I was referring to earlier about that recommendation list being published February 1st. And that brings us kind of to the end of that cycle. But if you can skip down to that next line, you see that in January, we're starting the process all over again. So hopefully that timeline made sense and you can kind of get a sense of, what's going on in the background after measures are submitted. Go to the next slide and we'll talk about, we can at least see the visual of the cyclical pre-rulemaking timeline. So as you see, you start at the red or the orange dot at the top where the measures are being submitted, and you follow this all the way around, and these are all the same events, but in January, that process starts over again for the next cycle. And that's all we really wanted to show for this slide. Next slide. These are just key important dates to keep in mind for the pre-rulemaking process. January 31st, which is already obviously passed, that's when Merit opens and we start to accept measure submissions. May 10th this year, Merit will close, and that's when the review of measure submissions begins. December 1st, we are statutorily required again to publish that list no later than December 1st. Next slide. We also wanted to just take a look at the MUC list historical trends. We think it's important to show this because this slide shows that CMS is working across its programs to align measures, reduce burden to measured entities, and to identify where there are measures where programs may have too many measures or where there may be gaps. And so one of the resources that CMS provides is the needs and priorities report, which goes through program-specific needs and priorities for each program that participates in the pre-rulemaking process. We also, on the MMS Hub, have all previous MUC lists and recommendation reports available publicly. Next slide. All right, so these are just considerations for measure submitters to think about when they are submitting a measure. I'll just go through a couple key considerations. So, it's important for measure submitters to know what CMS's quality priorities are. It's important to think about whether the measure is digital or not, or whether it's an outcome-based measure. We like to, have a measure be fully, or we prefer for measures to be fully developed, but that will not impact a measure that is not fully developed being evaluated. We want to, know if that measure, when it's operationalized, would it be burdensome? And we want to know things like, is it CBE endorsed? So just some things to think about when you're submitting your measure. Next slide. All right, so some other considerations. So measures that are currently used in CMS programs don't necessarily need to go back through a MUC list again, but there are exceptions if changes are being made to that measure. So if a measure is being extended into another CMS program, it would have to go back through the MUC list review. If measures currently used in a program are undergoing substantial changes, again, it would need to be pushed back through the MUC list again, or through the pre-rulemaking review. Measure specifications may change over time. So if a measure has substantively changed, it should be considered again. And so examples of those changes include that those changes change the intent of the measure. There's a data source change. The change includes a different setting or facility, or the level of analysis, are just some examples. So just some things to consider whether or not it needs to, go through this process or not. Next slide. All right. So this is the report that I had previously discussed, the needs and priorities report. And that is available on the MMS Hub for review. And it really highlights what the programs currently have for their measure inventory, and what they're looking to kind of get to in the future. So it talks about the program history and the structure. It talks about the high priorities for future measure consideration and the specific measure requirements for a given program, whether or not it's statutorily required for a program, things like that. Just an example. Next slide. All right, and I'm going to pass this back off to Batel, and I'm going to have Jake take back over. Thanks so much.
Thank you so much, Mel. So CMS evaluates the questions and the functionality of the Merit tool annually to make sure that everything is still in alignment with CMS and other interested parties' needs. So now let's take a deeper look at Merit and see what's new for the 2024 pre-rulemaking cycle. Next slide, please. So throughout today's presentation, we've mentioned CMS Merit multiple times. So what is CMS Merit? The Centers for Medicare Medicaid Services MUC Entry Review Information Tool is the tool for measure developers to submit their clinical quality and efficiency measures for consideration by CMS. CMS Merit, however, is not just a submission tool. By having login access to Merit, you can also use it for facilitating searches of measures from current and previous years. After measure submission period closes, CMS programs will then use the same tool to review the measures. Using Merit to review measures enables CMS programs to efficiently review measures and to communicate the measures to measure submitters if needed. As mentioned earlier in today's presentation, Merit did open for submissions on January 31st, and will close the 2024 submissions on Friday, May 10th at 8 p.m. Eastern. After this deadline, there will be no more submissions. And if you have not already, I recommend adding this date to your calendar just to make sure you have submitted everything you needed to before that 8 p.m. deadline. Next slide. So as displayed on the screen, Merit provides numerous features that have enhanced the submission and review process. Automatic completeness checks help ensure that all required fields are filled out before submitting. Submitters do not have to complete the full submission in one sitting. By saving and returning later, you are able to easily work as you can to submit your measures without feeling rushed. Submitters can track the progress of your submission to know where it is at every step of the process. Using human-centered design principles, Merit has an easy-to-navigate interface that helps provide a smooth experience with this tool. Merit also has improved copy and paste functionality and the ability to be able to copy and paste information from one document into the tool. And lastly, Merit has the ability to print and save a copy of your submission into PDF format. Next slide, please. So what's new to Merit in 2024? I think the most exciting change is that in 2024, we will have fewer required fields to complete. With the consolidation and removal of various questions, you will have less fields to worry about than in the past. Background questions have been updated to the new pre-rulemaking measure review or primer process, which was formerly identified as the Measures Application Partnership MAP process. There is a new required question to capture whether patient survey and tools used in quality measures have been translated into Spanish. And we have also revised the stage of development question to now ask submitters to indicate completed stages of development. In past years, we have asked what stage the measure was in, but for 2024, we are asking what stages this measure has completed. This change better reflects the iterative nature of the measure lifecycle. We'll go more into that in just a few slides. Next slide, please. So also new to 2024 is the request for all attachments submitted to Merit to be 508 compliant. Section 504 and 508 of the Rehabilitation Act of 1973 help to ensure that those with disabilities have equal access to government information and communication technology, and thereby to the government employment, programs, and services in which all citizens are entitled. Attachments are made available to the public to better improve transparency, and by being 508 compliant, allows for more accessibility to interested parties, which then allows for more meaningful feedback. I do want to note that CMS will still consider measures that are submitted to Merit with attachments that are not 508 compliant. I have provided some helpful resources that we'll share with you in the chat if you're not super familiar with the 508ing process. Next slide. So as I previously mentioned, new to 2024 is the updated stage of development question. In the past, the question was more around what stage of development is the measure in at the time of submission into Merit. For 2024, we're asking what stage or stages of development this measure has completed at the time of submission, again, with the goal to reflect the iterative nature of the measure lifecycle. I do want to note that with this change in question formatting, CMS still prefers measures that have been fully conceptualized, specified, and tested, but CMS will evaluate measures at all stages. Ideally, a measure should be fully developed, which includes the completion of appropriate testing. This graphic shows that CMS defines fully developed measures as those that have undergone reliability and empiric validity testing at both the patient encounter and the accountable entity level when appropriate. Additionally, for measures based on survey data or patient-reported assessment tools, including the patient-reported outcome-based performance measures, you must have reliability and validity of the survey or tool and the survey or tool does not need changes based on the results. For measures based on assessment tools, the measure developer must have completed reliability and validity testing for each critical data element and complete testing of the assessment tool itself with no changes to the tool needed based on the results. You can find the complete fully developed measure definition on the MMS Hub. With that, I want to pass over to Julia McApring of HSAG to go over the data fields.
Thank you very much, Jake. So we can move to the next slide. So there are a number of required data fields in Merit. And the use of these data fields supports CMS in addressing the Government Accountability Office recommendations related to systematic measure assessment aligned with CMS quality objectives. So to the extent possible, these fields align with the CBE criteria and the MMS blueprint criteria, and they are designed to streamline the collection of measure data by minimizing burden on measure developers and improving the flow. Next slide. So now I will review some key refinements made to the data fields for 2024. So specifically, the number of merit fields was reduced by about 30, as Jake mentioned. The guidance was enhanced to clarify submission requirements, and various fields were updated, including, as Jake mentioned, the stages of the measure lifecycle that have been completed, and the evidence section as well was streamlined. Next slide. So I will now review a couple examples of required data fields. So just to give you a visual here, the screenshot shows the field for completed stages of development. If you click on where it says view definition, it will provide guidance for completing the field. So as discussed earlier, you'll see that this item now asks submitters to select all stages of the measure lifecycle that have been completed. So if your measure has completed testing, you would select measure conceptualization, measure specification, and measure testing. Next slide. Another example of a required data field is meaningful to patients. This field has been updated to capture whether the majority of patients and/or caregivers consulted agree that the measure is meaningful and/or produces information that is valuable to them in making their care decisions. If you select yes for this field, you will be asked to provide a description of the input collected. And there is also an optional for a description of input collected from measured entities. This is now a single field that has been streamlined down from 3 fields from prior years. Next slide. And a final example of required data fields that have been streamlined for this year is in the evidence section. So for this field shown at the top here, type of evidence to support the measure, there will be just 2 required data fields for most of the evidence types you can select. So as an example here, we have peer-reviewed systematic review selected, and you'll see there's a corresponding free text field to collect a summary of the reviews and a checkbox field to collect the citation information. And the one exception I'll note is clinical guidelines, where there are a few more data elements required. Next slide. So thank you very much, and I will now hand it off to Mariah to discuss ECQM readiness.
Thank you. Good afternoon, everyone. This is Mariah Bauman representing Mathematica. So electronic clinical quality measures, or ECQMs, submitted to the call for measures involve additional considerations and requested information so that CMS can ensure that the submitted measures are ready for implementation in a CMS program. We refer to the steps that we will outline in this section as our ECQM quote-unquote readiness check. Next slide. ECQMs submitted for consideration in CMS programs must be specified using ECQM standards and designated ECQM tools. In addition to completing the fields in Merit required for all measures, CMS requests the following for each measure. First, a measure authoring tool or MAT output to show the measure is specified to the latest CMS and ONC standards in a way that aligns with.
I think we lost Mariah. Mariah, if you can hear us, I don't think we can hear you. Oh, apologies for that. We'll try to get her back real quick, and then we can come back to her section. I apologize for that. If we could move to the next slide here. Let's see here. Can we move to slide 35, please? We'll try to get her back, and then we'll come right back to her. Thank you. Again, apologies for that. So while we wait to get her connected, I will move on to the next section. I did just want to point out really quickly that there are some resources that we have available on this Merit Hub, or the Merit. It is the Merit Quick Start Guide and the Merit Data Template. They're both available to download on the CMS Merit login page. When we go to our live demo, I'll show you where those are available. We'll also put a link here in the chat for you. Additionally, we will be having a CMS Merit tips and tricks session on Tuesday, April 16th at 12 p.m. Eastern time, where we'll do a live demo walkthrough of that tool. We'll also put the link to registration in that. And then additionally, if you have any questions about CMS Merit, you can contact us at mmssupport@battelle.org. And we can go to the next slide. And we'll try to get Mariah connected back on. But for right now, we'll turn to Kim. So throughout today's presentation, we've mainly focused on those first two stages that are listed below that Mel discussed earlier. And we've talked about submitting measures to the CMS Merit tool and for CMS review. And we've also discussed that once CMS has conducted their review, the MUC list is then drafted and published on or before December 1st annually. I'd like to hand it off to Kim Rawlings of CMS to kind of go over what happens next after the MUC list is published. Next slide.
Thank you, Jake. Really appreciate it. My name is Kim Rawlings, and I'm with CMS. I am the CMS lead for the pre-rulemaking measure review process with the CBE contractor, Battelle. However, different team than the folks that you have here on this call. So like Jake said, I'm just going to talk a little bit about what happens if your measure were to be selected for the MUC list. What are those next steps in the process? So we had our first primer or pre-rulemaking measure review primer cycle in 2003, and then it just ended a couple of months ago. And this guidebook is a really useful tool and resource. It outlines all of the processes, timelines. It talks about the evaluation criteria, the composition of the committees that will be reviewing the measure, etc. Anything that you want to know about primer is in this guidebook. And so I think it'd be probably helpful to start taking a look at it now, though I will say that in the next couple of months, there will be a new draft of the guidebook out for public comment. So if you haven't already, I'd either start checking out the website or even sign up. That way you can get direct notifications about that. As I said, the first cycle was just ended a couple of months ago. And so there are a lot of successes that were had in that process. And then there are also some lessons learned. So if we can go to the next slide. While there will definitely be some changes to address these lessons learned, it's anticipated that the kind of overall process will remain largely the same. And so when we think about primer, we can split it up into kind of three different phases. The first one being information collection. The second is where there starts to be some analysis and feedback on the measures that are on the MUC list. And then the third phase, which is really that discussion and recommendation. And so, and this picture is big and very, and is explained in the guidebook, but just at a really high level. The idea is that the MUC list, along with the preliminary assessment of the measures on the MUC list, will be published no later than December 1st. From there, each committee is kind of split up into two different groups, an advisory group and a recommendations group. And that's really that information collection where all the information is collected and then it's kind of dispersed out into the public and specifically these committees. From there, the analysis and the feedback starts. And so there's around a 21-day public comment period that opens where anyone can comment. We had a pretty successful, I think, listening session last year where they could make verbal comments and welcome public, where there could be verbal public comments as well as kind of a Q&A to ask CMS and developers any questions. And then during that time, the committee was actually filling out evaluation forms. And then all of that information got compiled by the Battelle team. That way, kind of summaries and issues could be brought forward to the recommendation group. And so then in that final phase, the recommendation group then meets, they discuss, they ask more questions, and then they make a final recommendation to CMS. And then last but not least, the public has one more opportunity to submit some public comment and kind of comment on whether they agree, disagree, et cetera, with the committee's recommendations that have been submitted to CMS. And those recommendations are due no later than February 1st. So again, you'll see some tweaks and changes, and you'll have a opportunity to comment on those tweaks and changes. But overall, the process is going to flow pretty much like that. Next slide. And so measure developers, they play a really key role in the primer process, because we at CMS and the program and measure leads, they can explain why they selected the measure, why they think it would fit well in the program, but the measure developer has the most knowledge about the ins and outs of that particular measure, and so it's really key that they support their measure, and then through that also support CMS in these various meetings. And so there's kind of meetings and then there are non kind of meeting opportunities as well. So first in like the early to mid-November timeframe, there's a meeting to kind of go over the preliminary analyses and just some overall like education around the primer process and what's going to happen. Then in mid-December, there are listening sessions where, again, you can hear verbal public comment for the measures, as well as have the opportunity to directly answer questions that come in from committee members and the public on your measure. And this is really key because this is an opportunity to answer any misconceptions or any confusion about the measure before final comments are submitted. And then, of course, there are the actual recommendation meetings themselves, and those typically take place in mid to late January. There are also two kind of additional opportunities that measure developers have. One, if there's additional information that you would want to submit specifically to the CBE to, have the committee members receive that information as well. That happens in kind of the August and September timeframe. And then, like I mentioned earlier, there will be a period of time where you can kind of do a review of the draft preliminary analyses, not necessarily just to kind of like make sure that the document is accurate. And so, like I said, if your measure is selected on the MUC list, it doesn't stop there. There are really some key activities that we appreciate your support in as the measure is being reviewed and as it's being discussed by committee members. And I'll put a link or two in chat as well. So thank you. Next slide. I'm going to turn it back to Jake.
Great, thank you so much. And I do believe we have Mariah back, so we will go back to her section real quick. So we can go back to slide 31. And Mariah, if you are back, you can take it away.
Hi, everyone. I apologize for that disruption. So I'll start from the beginning of the slide. So ECQM submitted for consideration in CMS programs must be specified using ECQM standards and designated ECQM tools. In addition to completing the fields in Merit required for all measures, CMS requests the following for each measure. First, a measure authoring tool or MAT output to show the measure is specified to the latest CMS and ONC standards in a way that aligns with existing ECQMs and CMS programs. Second, a Bonney test case export showing a minimum of 100% passing and 100% coverage of all branches of the measure's logic. Third, published value sets in the National Library of Medicine's Value Set Authority Center, or the VSAC, that have been validated against the most recent terminology expansion with 100% active codes. Lastly, CMS is in the midst of a digital transition to Fast Healthcare Interoperability Resources, or FHIR. If the measure steward has already begun specifying the ECQM and FHIR standards, CMS requests the measure steward also submit the FHIR specification MAT or MATI output and Bonney test cases. So the words in bold on the slide right now represent the additional information that are requested in Merit for each ECQM. That MAT output, the Bonney test case export, attestation to using the VSAC, and the FHIR specification output. Next slide, please. ECQM submitted for consideration in CMS programs should meet CMS's definition of a fully developed measure. In addition to the previously referenced requirements, measure stewards need to complete and submit a feasibility scorecard for an ECQM. The goal of the scorecard is to illustrate that the data elements required for the measure can be captured in structured fields using data standards within existing workflows. Similar to the last slide, the bold font on this slide represents the additional information requested in Merit for ECQMs, and that's the feasibility scorecard bolded on that slide. Next slide. Everything covered in the ECQM readiness Step 1 and Step 2 slides relates to work that CMS requests to be completed, documented, and submitted for review as part of the call for measures for consideration in a CMS program. This slide is intended to provide information on what the measure steward can expect following submission, both in preparation for inclusion in a CMS program and continued maintenance if implemented in a program. The measure steward is expected to 1, understand and apply ECQM standards, including Quality Data Model, or QDM, Clinical Quality Language, or CQL, and HL7 FHIR. 2, make and test technical changes using ECQM tools, including the MAT, Bonney, MATI, and VSAC. 3, participate in the ECQM annual update process, which is distinct from update cycles for other measure collection types and may begin at different times than update cycles for other collection types. 4, adhere to the timelines and processes set forward for the ECQM annual update for both QDM-based and FHIR-based specifications. And 5, support responses to interested parties' questions on the measure throughout the year. Next slide, please. CMS would like to use this forum to reiterate 2 additional considerations for stewards of ECQMs. First, CMS is in the process of decommissioning MAT and Bonney. These tools will no longer be accessible after June 28, 2024. All ECQMs, included those submitted to this call for measures, will need to migrate to the new MATI tool by this date. More information on the migration is provided on the MAT and MATI resource links that are included on this slide. And second, as previously mentioned, CMS is continuing its path of digital transformation. Right now, ECQMs in all CMS programs use QDM, but CMS is in the middle of transitioning to using FHIR. There will be a period of dually maintaining QDM and FHIR-based specifications to support the future state of all ECQMs expressed in FHIR. And more information on CMS digital quality measures and FHIR is available on the ECQI Resource Center, and that link for the ECQI Resource Center is provided on this slide. Thank you for your continued interest in support of ECQMs and CMS programs, and I will now pass it back to Jake.
Great, thank you so much. So now, before we get to the question and answer section, I want to just do a quick screen share to kind of go over some resources available to you as you work on submitting your measures to Merit. So let me share my screen real quick. All right. And as that is popping up, I want to begin with the Merit tool itself. If you have not requested an account for Merit before, I would recommend that you do that soon rather than waiting until you need to begin submitting. It does take on average about 24 hours to process your account, so keep that in mind. So if on the screen we look under the Forgot Your Password, there is a Request an Account button. So let's go ahead and click on that. From here, it's going to ask for your first and last name, organization, email, phone number, and then which site you would like to access. If you already have access to CMIT, that does not mean you have access to Merit, and you have to ask for each of those individually. Having one does not mean you have the other. So once you fill out this form and you select which site you would like access to, which, as a quick note, if you would like to have access to both and you don't already have access to both, you can do that at the same time to help save you a little bit of time down the road. Once you fill it out, go ahead and click that submit request. You will then get an email response to the email that you listed once your account has been activated. And that email will tell you how to use the two-factor authentication that we use. Merit uses a Google Authenticator for the non-CMS staff, so it'll ask you to download an application to receive that two-factor authentication code. So let me go back to the main screen here real quick. And as we mentioned during the slides, there is a quick start guide and a Merit data template that are available here at the bottom here. The Quick Start Guide helps you guide and navigate the tool Merit, where the Merit data template is a great resource to help you navigate the questions being asked. Just above it, there is also a quick link to the MMS Hub Pre-Rulemaking webpage. That is actually where we're going to be transitioning next. However, I'm not going to use that link. I want to show you how to get to the Pre-Rulemaking webpage from the main Hub page itself. So let me transition to the Hub. And so here is the homepage for the MMS Hub. If you're not fully aware of what the MMS Hub is, the CMS MMS Hub is your trusted source for quality measures and quality measure development and maintenance information. The CMS MMS Hub is the home of the content previously found on the MMS Blueprint. And there's actually two different pre-rulemaking pages on the Hub that I want to share with you. The first one on this ribbon is if we come to Blueprint Measure Lifecycle, and we come down to Measure Implementation, there's a pre-rulemaking. There's actually 4 different subsections of the pre-rulemakings tab, and I'm going to start first with the overview. The overview tab lists a high-level overview of the pre-rulemaking process and also provides a high-level timeline that gives viewers a general timeline of the pre-rulemaking cycle annually. So I know Mel showed a more detailed timeline. This is one that's more high-level that will kind of just give you an idea annually without those specific dates on it. The next tab I want to go to is that guidance for measure submitters. This tab helps introduce measure submitters to what Merit is and to provide some helpful resources and information such as the data template, the quick start guide, but also the peer-reviewed journal article template for candidate measures for the Merit-based incentive payment system, or MIPS. So on here, you'll also get the Merit login or the Merit link. You'll also have a link to the Hub main page. You'll have the data template, quick start guide, and then here's that peer review journal article template. Under the Measure Priorities tab, this tab provides information on CMS's goal to fill gaps in measurement with the measures that align and support with the Meaningful Measures Initiative. This tab also highlights both the Needs and Priorities Report and the CMS Quality Measures Development Plan to learn more about program-specific needs and priorities. As I mentioned, right here you can find the Needs and Priorities Report, and right here is the Quality Measure Development Plan. If you want to learn more about Meaningful Measures Initiative, you can click on this and it'll take you to their website as well. And then finally on this page, there is the MUC list and recommendation reports tab. As discussed in the presentation, this is where we house the repository of all the past MUC lists and the recommendation reports. So as you can see, we have from 2011 to 2023. And if we scroll through, we have all the different recommendation reports. There is another page that is pre-rulemaking specific that I just quickly want to direct us to. And if we actually go back to the overview page and we scroll down to the bottom, there is a resources tab. And if we click on that, you will actually see 3 things in this section, and 2 of them are actually the most up-to-date current MUC list. The second one is the additional pre-rulemaking resources. And when we go to this, it's actually going to have some additional resources, but I want to show you, if you come up here to the tools and resources, you can find that location here as well. So let me click on this. And then on this screen, you're going to see some links that you've seen before, like the link to Merit, the data template, the quick start guide, but also there is a pre-rulemaking frequently asked questions that we develop annually that kind of encompasses a bunch of questions that we have been asked before that we think is very helpful to people that are going through the measure submission process. So I'd highly recommend, if you have not seen that before, to take a quick look at that. Just below that is the needs and priorities document that we just published. And then this is also, this webpage is where we house the different resources for these education and outreach materials. So you can see that we have the tips and tricks and the kickoff webinar here. They all say coming soon. So as new information is collected, as we get the recordings ready, the QA summary, we will upload those here. So after today's webinar, you should see the slides popping up right here. And then finally, this page does hold the MIPS resources, such as the MIPS peer review journal article requirement template. There's examples and also both the quality and cost MIPS annual call for measures fact sheet. And with that, I want to go back to the slides now, and we can go ahead and transition into the Q&A section. So next slide, please. Just before we get to the Q&A, I do have a quick poll I'd like for us to fill out if you can. There's just 3 questions, and it's really going to help us improve our pre-rulemaking education and outreach efforts. So you should be seeing that poll popping up here in any second now. And while we are answering that poll, I just wanted to plug a couple upcoming MMS educational opportunities that are going to be coming up next month. As I mentioned earlier in this presentation, we are going to be holding on Tuesday, April 16th at 12 p.m. Eastern Time, the CMS Merit Tips and Tricks session that will go over the ins and outs of the Merit tool itself. That webinar will have a live demonstration of how Merit works. So if you are new to Merit or just need a refresher, it should be a great experience. And then also on Wednesday, April 24th from 2 to 3 p.m. Eastern, we'll be having our April MMS information session titled Meet Maddie, the electronic clinical quality measure development and testing tool. Registration will both be available in the chat and can be found under the news and events tab in the MMS Hub. And with that, we can move to the next slide, and it's time for the Q&A. I'm going to pass it off to my colleague, JJ Knight, to help moderate the Q&A discussion.
Awesome. Thanks so much, Jake. Happy to be here with y'all today. So let us get started. Mariah, actually, I have a question for you. Where can I find more information about the standards that should be used to specify ECQM submitted for consideration?
Sure. So you can find more information about those standards and the tools used for ECQMs and CMS programs on the ECQI Resource Center, and that link was provided on one of the slides that I presented on. And for more specific information on the standards and the code system versions used in ECQMs included in CMS quality programs for the 2025 reporting and performance period, you can review the ECQM Annual Update 2024 pre-publication document. That is on the ECQI Resource Center that was published in February 2024, and we can include a link for that resource as well.
Awesome. Thank you so much.
Thanks.
Jake, we actually have a few questions for you that I think we'll just hit back to back. So first, if a measure is currently undergoing testing, but will be fully developed between the Merit submission and the MUC list publication, is there an opportunity to update the Merit submission?
Yeah, great question. So measure submitters should submit their most up-to-date and complete measure testing prior to the closing of Merit by 8 p.m. Eastern on that Friday, May 10th. There is no option for submitters to update measure testing information in Merit once the submission period closes. However, updated testing data for select measures will be requested per CMS in the fall.
Awesome. Thanks, Jake. And then just as an additional question while I have you, have the Merit questions been changed to align with the evaluation criteria that are used during primer review?
Yeah, great question again as well. So each year we do update the Merit questions based on evolving measure science and CMS priorities. And it does undergo a comprehensive review from multiple parties, including the Partnership for Quality Measurement team.
All right. Thank you so much, Jake. Appreciate it. All right, Mel, we got a question that I think you already answered in the Q&A feature, but I'm hoping maybe we can jump in and share with everybody. Can you explain a bit more about the time between when Merit submissions are due and when the MUC list is posted? For example, what is happening during the review of candidate measures compared to the review of the MUC list?
Hi, thanks so much. Yeah, and I did answer this, and maybe this question was asked prior to showing the timeline, but if we could go back to the timeline slides, that would be great. And we could just talk through it. But ultimately, you know, the process includes CMS programs reviewing those measures prior to us compiling their recommendations and creating that draft muck list that goes on to be reviewed at the HHS level. So there is a chunk of time that is taken up by CMS programs reviewing the measure submissions, as well as acquiring, you know, federal stakeholder feedback on the measure submissions. I hope that answers the question. Thanks.
Thanks, Mel. Julia, and this is one I know that you added in the Q&A feature, especially because there's links involved, but I'm hoping you could address, how do we figure out if the data elements that are in defined fields in electronic sources align with USCDI version 4 or USCDI plus quality draft standard definitions?
Thank you. So we did include this information in the guidance for this item in Merit. So there are links included where you can access this information. And what measure developers can do is they can compare the data elements used in their measure with those listed at the web pages.
Awesome. Thank you so much, Julia. All right. Kim, who will see the information that a submitter submits? Will primer committee members receive everything in Merit?
Thanks, JJ. That's a great question. So that's definitely what we're aiming for. So as I mentioned in my presentation, the like PQM Battelle team does create these preliminary assessments where they work to kind of summarize and present the measure in a way that is meaningful. Unique to this year, we're also and a lot of the all of the information that is in that preliminary assessment comes from the Merit tool. So it's not necessarily like a copy and paste of everything in the Merit tool, but it is a kind of a I don't want to say summary, but you know, it's kind of like a reconfiguration, I guess, of that information. Additionally, this year we're also looking at including all of the attachments as well. So that's something that we are actively exploring, because we know that committee members want and need the testing data, the codes, the specific survey questions that are in the assessment, etc. The more information, the better. And so, in short, yes, all of the information that is shared in Merit in some form or fashion will be not only given to committee members, but it will be made public as well. Thank you.
Thanks, Kim. I like it. More information, the better. All right, Jake, here's one about using Merit. Do all of the data fields need to be completed in CMS Merit to submit a measure?
So all required data fields must be completed to successfully submit a measure. They are identified both in Merit and on the data template with a red asterisk. So that is a requirement that those have to be completed before you submit a measure.
And Jake, while I have you, we just had one come in that asked about formatting, and I think you'll be able to answer this one. Since the Merit portal mentions pasting as plain text, do you recommend no tables be included in the text box, just provided in a supplemental document?
Yeah, so that's a good question too, and it's kind of it's a good question. So we actually recommend two different ways. We recommend that you can try pasting it in. If for some reason it goes in and it seems like it's not formatting correctly, we then would recommend that you paste it as plain text. So it's more or less it should fit in there. But if there's a weird case that it's not, we would recommend that you would then paste it as a plain text option.
Awesome. That is super helpful, Jake. Yeah, we don't want things getting all wonky on us. Mel, I think we had one come in that would be helpful coming from you. CMS has indicated there are gaps in measurement areas, but there's clearly a marked decrease in the number of measures being submitted based on the graph shown. What is CMS doing to reduce the burden on measure developers and facilitate the development of important measures?
Hi, yes, I believe I did answer this question, but our goal at CMS is to align quality measures that are submitted across programs, and we are constantly evaluating the gaps in program measure profiles, and we're also trying to decrease where we may have too many measures in one area. And so I would suggest, for more information on that, one, the needs and priorities report, which kind of shares where it's updated annually by programs to kind of reflect what their measure profile looks like and what they feel that they need based on their measure requirements. But also there is resources out there to kind of highlight CMS agency-wide priorities and initiatives like the Meaningful Measures initiative, which highlights measure priorities, as well as the Cascade of Meaningful Measures framework, which helps to map out our measures and help us identify where there may be gaps or where there may be too many quality measures in one area. I hope that answers the question. Thanks.
Thanks, Mel. And with that, we're almost at the top of the hour, so I am going to pass it back to Jake to wrap things up for us. Thank you so much for all your great questions.
Thank you all again for attending today's webinar. As a reminder, the presentation slides will be available on the pre-rulemaking resource page on the MMS Hub following today's presentation. A presentation recording and the Q&A summary will be published on the Hub in 3 weeks. And if you have any questions that come up before then, please email us at mmssupport@battelle.org. Thank you all again, and I hope to see you all next month.